There is a special energy at the ASH annual meeting where experts are advancing the field of hematology with one scientific discovery at a time.
Yes, and ASH News TV has been fully engaged in all aspects of the meeting, including covering a number of special interest sessions. I got to speak to Dr. Leslie Ellis and hear all about the key takeaways from this session.
This symposium is where medical educators come to learn the cutting-edge teaching techniques, and I'm joined by Dr. Ellis. Dr. Ellis, what do you hope that the medical educators will be able to take from this symposium and bring back to their institutions?
So, we've had some wonderful sessions today about many different concepts that affect medical educators, the first of which is burnout. And so one of the things that I hope that our medical educators take home is that we're all susceptible to burnout and we all need to take care of each other. We also had a wonderful session about mentorship. And so, we all think of ourselves as, I think, being mentees still, no matter where we are in our training, but recognizing that there are some best practices for being a mentor and recognizing the potential impact that we can have on our learners, either in the classroom or through a formal mentor-mentee relationship. I hope they take some components of that talk away as well. And then finally, one that's near and dear to my heart is the concept of medical education scholarship. So recognizing that for all the hard work that our medical educators do, they should share that through publications and presentations. And so we focused during a general session as well as my breakout session about some steps to participate in rigorous medical education research. And so I hope that our medical educators think about sort of getting a twofer for what they do. So not only educating our trainees, but also thinking about how they can get a publication out of it as well. Again, to share the knowledge so other people don't reinvent the wheel.
Yes, we don't need to reinvent the wheel,
No.
It exists. But how are we able to both recruit and retain talent in the field of hematology? What advice do you have for the teaching professionals?
So this is something that ASH feels very strongly about. They participated in a task force study a few years ago that shows that within a few years we're going to have very few hematologists to help take care of all of our patients. And so in addition to taking care of ourselves by focusing on our burnout, in addition to being a wonderful mentor and participating in scholarship, one of the most important things that we can do is just share our love of hematology and just to let everyone know what a wonderful field it is and ultimately how our patients are just the most wonderful patients. And it really is an honor to be able to take care of them through all of these different aspects that we've covered at the Medical Educators Symposium today. Ultimately, what will happen is that our love of hematology will spread to others.
Yes, and you're doing that partially right here on ASH News TV with
Wonderful,
us. So thank you so
wonderful.
much for your time, Dr. Ellis.
You're very welcome.